If you're thinking about becoming a physician, one of the first questions you'll encounter is, should I apply to MD schools or DO schools or both? For many pre med students, especially those just starting their journey, the differences can seem really confusing. Do they take the same classes? Can they become the same types of doctors? Do they have the same residency opportunities? And does one degree have an advantage over the other? Welcome back to my channel. My name is Grace, and I'm a recently graduated U.S. physician who will be starting my intern year in family medicine. On this channel, I share my experiences through medical education, physician life, and practical advice for students considering a career in medicine or those already in medicine. Today, we're breaking down the similarities and the differences between MD and DO programs, including the admission requirements, medical school training, licensing exams, residency match rates, and what life looks like after graduation. So let's get started. First, let's define the two degrees. So, MD stands for Doctor of Medicine, DO stands for Doctor of Osteopathic Medicine. Both degrees allow graduates to become fully licensed physicians in the United States. So that means both can prescribe medications, both can perform surgery, both can practice in every medical specialty from family medicine and pediatrics to other highly competitive specialties such as ophthalmology and orthopedic surgery. So at the end of the day, both are physicians, with one third of doctors actually being DOs. Let's also talk about medical school admissions. So the requirements for MD and DO schools are very similar. Both generally require biology, general chemistry, OChem, physics, biochemistry. Both require the MCAT. Both evaluate GPA, volunteer work, clinical experiences, leadership activities, research, letters of recommendation. Historically, DO schools have had a slightly lower GPA and MCAT stats compared to MD schools. But to give you a general idea, MDs usually have an undergrad GPA of 3.77 and an MCAT of 512. And for DO programs, average GPA is usually 3.6 and MCAT is like a 506. Let's talk about differences in training. Once you're accepted, the first 2 years of training look remarkably similar. Students in both types of programs study anatomy, physiology, pathology, micro, all of the basic sciences needed to practice medicine. Both have clinical rotations in the hospitals, third and fourth year. The biggest educational difference is osteopathic manipulative medicine, or OMM. DO students receive additional training in hands on techniques used to diagnose and treat certain musculoskeletal conditions. These techniques decrease muscle tension and help restore joint mobility. This means DO students would have an extra set of coursework and practical examinations throughout medical school to learn this skill. What this looked like for me as a DO student is I had OMT classes years 1 and 2 with a practical every quarter. Year 3 and 4, I mostly just practiced on my clinical rotations and had to submit the procedures I had done to my school. Some physicians will use it in practice, while others rarely use it. It's mostly dependent on personal preference and specialty. Outside of OMT training, the educational experience between MDs and DO programs is much more similar than many people realize. Licensing examinations for both is going to be a bit of a difference between the two. MD students typically take the United States Medical Licensing Examination, or USMLE. DO students are required to take the Comprehensive Osteopathic Medical Licensing Examination, or COMLEX. Many DO students will choose to take the USMLE in addition to COMLEX, especially if they plan on applying to a more competitive residency program. This means that some DO students end up preparing for two separate licensing exams. With the change of Step 1 and COMLEX Level 1 to pass-fail, some DO students will not take Step 1 and only take Step 2 in addition to their COMLEX exams. For me, as a DO that applied to family medicine, I took COMLEX Level 1, I skipped Step 1, and I took both COMLEX Level 2 and Step 2. So this can be an additional workload that you would have. Another aspect is the residency match rates. So that's another huge common question. So both MD and DO match into residency at a pretty similar rate, but there's some differences. So the MD match rate is about 93 to 94%, and the DO match rate is 91 to 93%. Overall, that MD graduate has a slightly better chance of matching, but only by a percentage or two. The biggest difference really tends to be more in the competitive specialties, such as like dermatology, plastic surgery, orthopedic surgery. These competitive specialties can be harder to match into as a DO. It's definitely still possible. So I know people from my own school who match dermatology, orthopedic surgery, etc. I think you just need to be more strategic about which residency programs you apply to. As in, if you look at their website and they have no DOs in their current program, probably not a DO friendly program. Most programs will have a mix of both MDs and DOs. Both graduates match into excellent residency programs. And as someone entering family medicine myself, I can tell you that residency programs are increasingly focused on finding qualified applicants who will be excellent physicians, regardless of the MD or DO status. So, to summarize, both MDs and DOs attend 4 years of medical school, complete residency training in any specialty, pass licensing examinations, care for patients, prescribe medications, diagnose disease, perform procedures, and dedicate their lives to medicine. Once you're practicing, your patients are far more interested in whether or not you're going to be a compassionate, knowledgeable, and trustworthy physician instead of if you have a diploma that says MD or DO. So, which should you choose? Which path is right for you? The answer depends on your goals, your application, and the schools where you get accepted. If you're fortunate enough to have multiple options, it's best to consider what type of curriculum they have, the location, the cost, clinical opportunities, your support systems in those areas, board exam performance, and their overall fit. Also, consider if you want to have another modality such as osteopathic manipulative medicine to treat your patients. I'm really grateful that I went to a DO school and learned another tool to help treat my patients. So, whether you choose the MD route, the DO route, or you're still trying to decide, just remember this: both paths lead to becoming a physician. Both paths require hard work, sacrifice, and resilience. And both paths offer the same opportunity to make a meaningful difference in the lives of patients. I'd love to hear from you. Are you planning to apply MD, DO, or both? Leave a comment below and let me know where you are in your journey. And if you found this video helpful, please like, subscribe, and share it with someone who's preparing for medical school applications. Thanks for watching, and I'll see you in the next video.